Today we're celebrating Nurses Appreciation Day, which honors the hard work of our frontline workers throughout the country. Nurses were faced with unprecedented challenges back in 2020, and they've continued to treat some of the sickest COVID patients now for more than 2 years.
Yeah, they've been administering vaccines while confronting the mental health challenges of patients, and boy, do we appreciate them. And we have the chance to honor their contributions by having two of these superheroes with us this morning. I want to welcome Columbia nursing student Alden Bush and the Dean of the Columbia University School of Nursing, Lorraine Frazier. Thank you so much, both of you, for joining us this morning. And Lorraine, I want to start with one of the big headlines we've seen throughout this pandemic that Joe just mentioned, which is that burnout among healthcare professionals, even to the point where many nurses have considered leaving the field. So first, I'm just wondering how you and colleagues in this profession are doing 2 years in, but also how do we address that? What do nurses need right now?
Well, that's a great question. Nurses are stretched and they're stressed. And so they need some time to really think about their quality of health. But more than that, they need to be valued, they need to be heard, and they need an environment that's psychologically and physically safe. One of the things we do in education now is we try to talk about health and well-being. But more important than any of that is they need support at the bedside. We need more nurses. We can't work with staffing shortages throughout the country. Right. So we need more scholarships, we need more students, and we need to educate more nurses across the country. That's our number one, I think, important point to think about when we think about burnout and support.
And that brings in perfectly our student here, our nursing student, Alden. You were able to gain some really valuable experience during the pandemic, gave out vaccines, worked with local communities on the issue of mental health. What's the experience been like for you, and were you ever surprised by anything you saw on the job?
Thank you for having us, firstly. Being a Columbia nursing student during this critical time was difficult. There was a lot of access issues, a lot of health disparities that were being seen on the ground, and being able to, be a Spanish-speaking nursing student and nurse and provide services in this critical time and, fight misinformation and other things of that nature was invaluable.
Wow, fighting misinformation, such an important point. Lorraine, you mentioned needing more nurses. Actually, applications for nursing school have gone up significantly since the pandemic began. I imagine that's a good sign for getting people into the field. How does that make you feel, and what do you think is the driving force behind that?
It really surprised us. We thought nobody will ever come into nursing again. But people, we had higher applications. We have the largest class we've ever had coming up this year. People are leaving other professions, I think, because they want to make a difference. They're coming from engineering, from law, from art, from dance, from all kinds of people are coming in. And I think they're coming in for the perfect reason. They want to make a difference in people's lives, and they want to have a purpose beyond a paycheck. And nursing is a great profession.
It definitely is. Alden, you have some big goals for your career. You want to provide mental health and primary health care in Latinx communities. You're a first-generation college graduate, first-generation American. How did COVID, and you talked about disparities just a moment ago, but how did COVID highlight the difference in health care for Hispanic communities, which were hit so hard by the pandemic? And what are the programs you want to see then put in place?
I think that one of the important programs that I'd like to see is more community mental health outreach. There's a lot of stigma in the Latinx community when it comes to talking about mental health and addressing depression and anxiety, which has seen a huge uptick since the start of the pandemic. And, one of the important things that I want to dedicate my life to is helping these communities and, hopefully seeing nursing colleagues, also take up and use psychotherapy and other tools. So if there's any nursing colleagues out there listening to me right now, I really urge you to sit with yourself. And if you need help and support, all you need to do is reach out. The help is there.
Lorraine, before we let you guys go, I just want to give you the opportunity to tell our viewers, what does anybody at home need to know about a nurse's job? What do you want them to know about what these last 2 years have been like and where you're at now?
I would like the patients to know that we're there for them, and we will continue. We've been there in the pandemic. We will continue to be with them, to support them. In order for people to have healthy communities, they need nurses in those communities to support not just during healthy times, but times of stress and pandemic. And we're going to be there. We're going to educate more nurses, and we're going to organize, and we're going to have an influence on healthcare in the future. And I think that's really important for people to know. This is Nurses Week. We're celebrating nursing nationwide, and nurses have a lot to offer. And we're happy to be part of the solution for healthcare.
Lorraine, Frazier, and Alden Bush, thank you for joining us. But more importantly, thank you for choosing this career path and helping us all. And for, of course, the last 2 years. We do very much appreciate you. And viewers at home, thank a nurse today. Show your appreciation.
Yes.
Exactly.
Thank you.
Thank you
both. All right.
Thank you
Have a
for your
great
time.
weekend.